President.
Senator from Colorado.
Thank you, Mr. President. Is the Senate in a quorum call?
No.
Thank you, Mr. President. I appreciate the opportunity to come to address my colleagues today in the Senate, Mr. President. During the course of this shutdown, what has now become the longest shutdown in American history, there are a lot of people around the country wondering about what has been at stake in this debate and in this argument. And I think with every day that has gone by, it has become clearer and clearer what is at stake. I have heard my Republican colleagues, including the leader of the Republican Party in the Senate, come to the floor to say over and over and over again that not a single Republican in this chamber, not a single Republican in the United States Congress voted for the Affordable Care Act when we passed it in 2010. And for them, that's a badge of honor. That's a badge of honor that they recall from the last extensive debate we had around here about health care. And I deeply regret the fact that they are so proud of not having voted for the Affordable Care Act. It's true, there was not a single Republican in the Congress that voted for that bill. And that bill was far from perfect, I'll admit that. Even at the time, I was leading the fight for a public option to be included as part of the Affordable Care Act, Mr. President, because I thought it would be a very important part of constraining costs for the American people in our health care system. I'll say more about that in a minute. In the end, it was not included. In the end, we couldn't overcome the objections of the special interests who wanted to not deny the American people that choice, but it was an important case to be made, and we made that case. But I voted in the end for the Affordable Care Act, even though the public option was left out of it, because it did some really important things for the health care system in America. And most of those had to do with making sure that the insurance companies couldn't throw you off your insurance just because you got sick, that cancer and other conditions could no longer be a pre-existing condition, that you could still get health care even if you had the misfortune, as I have had, of having cancer, that there would be no lifetime cap that would prevent you from being able to provide health care or mental health care for your children or for your family just because things had gotten expensive over a period of time. And these were really critical decisions that were made as part of that bill, in addition to the expansion of Medicaid across the country, to be able to ensure that more working people had the chance to be able to afford health care. Which brings to mind one of the really unusual, the unusual context in which we have health care debates in America, which is that we are the only rich country in the world. We are the only industrialized country among all industrialized countries where health care is not a right of citizenship for everyone who lives in that country. And notwithstanding the fact that we have less access to health care than any other industrialized country in the world, it costs twice as much in the United States. It costs twice as much for the federal government. It costs twice as much for our society. And most important, it costs twice as much for the people that we represent in our various states, including in the state of Colorado. People in Colorado, as we meet here, are struggling with the cost of housing, the cost of food, the cost of President Trump's uncertain and unpredictable tariff policy. But they are also continuing to struggle with the cost of health care because we are spending twice what any other industrialized country is spending to get a worse result. I know the President knows this, the President of the Senate knows this, because he's a doctor. And I've heard him talk about the condition of our health care system Today in the United States, our life expectancy is 6 years shorter than it is in any of those industrialized countries. What greater indictment could there be of this system? In the 1970s, we had the same life expectancy as the rest of these countries. In fact, we were in the middle. And in the years since, we have fallen farther and farther and farther behind as we have spent more and more and more money. Because the system we have is so shot through with benefits for special interests, among other things, and a complete lack of transparency, which is a fancy way for saying that literally nobody has any idea what anything costs in our healthcare system. I know the presiding officer agrees with that. You can't tell what anything costs. When you show up to fill a prescription, when you're in the emergency room, we've worked together on the surprise billing issue, which is an important part of this. If you're a senior that's trying to get your prescriptions filled, you go from one pharmacy to the next to the next. I'll never forget, as long as I serve in public office, and probably for my lifetime, the conversation I had with senior citizens in Pueblo, where they basically were telling me that their entire retirement was spent fighting to get prescriptions filled that their doctors had assigned them, prescribed them. Seniors in other countries, in other industrialized countries, don't spend their retirements doing that. Only in the richest country in the world do seniors have to do that. And that's because a lack of transparency, a lack of clarity is built into our healthcare system from top to bottom. But we took some important steps in the Affordable Care Act. I wish that it had included a public option. It didn't. I think that the rate of rise of our healthcare inflation would have been a lot less. And by the way, that is what the people that have looked at that bill and scored that bill over the years have said. We've been fighting for it now for a decade and a half. They've said that it would actually save the government money because it would lower healthcare costs. It would introduce some competition into our insurance market. And I'll say this to the presiding officer, he'd probably be amused by it. This is the one place where I really am a Bolshevik. I believe in universal health care for all Americans. I think we should provide that to people in this country as a right. There is no reason not to do it in the richest country in the world, especially if we can save half of the cost of health care that we're providing now. And families all over my state, all over Colorado, are fighting to get their kid the mental health care that they need, are fighting to get their parents the prescriptions that they have been prescribed, are fighting to hold on to their own health insurance because that also has become less and less affordable over the years. That is a fight that no one else in the industrialized world has to have. And I think it's important to point out that most of the people that I'm talking about, almost all the people that I'm talking about, are working for a living in this country and still can't afford health care, still can't afford the peace of mind that they know that if their kid breaks their leg on a hike or breaks their leg skiing or needs to have the benefit of a mental health counselor, that's something that our safety net provides. Because health care should be a right. It is a right. And whether you get it or not shouldn't be determined on how wealthy you are or where you live, Mr. President. And I think given the rhetoric that I hear out here sometimes about makers and takers and all that other stuff, it's important to point out that almost all the people that I'm talking about are working or taking care of children or are retired. We should have a universal health care system in this country. But in the meantime, Mr. President, we shouldn't be making matters worse, which is why this debate is so crazy. When we passed the Affordable Care Act without a single vote from the Republican Party in the House or the Senate, they said that they were going to make President Obama a one-term president. They said I was going to lose my Senate seat. In fact, I was asked on national television whether I would lose my Senate seat as a result of my vote on the health care bill, and I said, if that's the cost of being here for that period of time, it's worth it. I'm happy to lose based on that vote. And they ran ad after ad after ad during that campaign, attacking me for being the 60th vote for the Affordable Care Act. And because I survived and a couple other senators barely survived, we were able to preserve that bill, and 30 million people who would have lost their health insurance in America didn't lose their health insurance. And then the efforts in the House began to repeal the Affordable Care Act. And Mr. President, they voted, I lost count, I think it was 70 times to repeal the Affordable Care Act in the House of Representatives. At least 70 times. They never were able to do it, and the longer it was there, the more people came to see the benefits of the insurance protection, came to see the benefits of the expansion in Medicaid, came to see the benefits of at least having a little bit of comfort that they couldn't just throw you off your insurance because they felt like it. And now we have found ourselves in a debate related to the tax credits that so many Americans rely on to make the insurance just a little bit more affordable. I wouldn't say affordable. I'd say a little bit more affordable. I'd say barely affordable, but somewhat more affordable at a moment when grocery prices are what they are, at a moment when rent is what it is, at a moment when we're dealing with the incredible uncertainty that these tariffs are causing. It would seem the least we could do is not make matters worse. The least we could do is extend the benefit, the tax credit, so it's a little bit easier for people to buy insurance for themselves and for their families. But just like, Mr. President, with the passage of the Affordable Care Act, when not a single Republican supported it, just like when they voted 70 times in the House of Representatives, 70 times to repeal the Affordable Care Act, during this period, this episode, this shutdown, the longest in American history, the Republicans have voted 15 times to take away those benefits from the American people that they're relying on just to make insurance a little bit affordable. And we have taken the position that we shouldn't make matters worse. And, Mr. President, that's why I voted again against the budget that's been proposed by President Trump and the Republicans, because they refuse to extend the tax credits. They refuse to make things just a little bit better for the American people. I can't say I'm surprised by the position. Who could be surprised? After a vote on the Affordable Care Act where nobody joined it, all those years of voting to repeal it, running to make President Obama, they said, a one-term president. And now the vote, day after day after day, to not provide the American people the benefit of those tax credits. And before this debate closes, I just want to say again, Mr. President, that the current system is in dire need of help. The American people are hanging on to their fingertips when it comes to the cost and availability of health care. There is no rich country in the world that doesn't have a universal system of health care. There is no rich country in the world that doesn't routinely supply access to doctors and primary care, access to mental health care for families and for kids, prescription drugs that don't cost an arm and a leg. It is not a pain point for those people in the different phases of their lives, much less a pain point every single day, which it is for the people that I represent in Colorado. So apparently President Trump is going to get his way, and those tax credits are not going to be extended by the majority here. And the cost of health insurance in Colorado is going to increase by 200% for some people, 300% for some people, 400% for people that are living in rural areas in my state. That's thousands and thousands of dollars to a typical family that just doesn't have that kind of money, Mr. President. And I just want to remind everybody in this chamber that when this debate is done, we still have a very important project that we need to be engaged with the American people. And that is to be able to provide a health care system like other wealthy and industrialized countries have provided, where people can count on their health care, where they know it's not going to cost them an arm and a leg, where they know in the course of their lifetime there are other things they can worry about, like the cost of their rent and the cost of food. But one thing we're going to do is take care of this problem, just as countries all over the world have taken care of it for their citizens. I wish I could say that the politics around health care have gotten better over the years that I've been here. They really haven't, Mr. President. But I think that the debate that we have had in this moment is going to serve to clarify who's fighting to try to make this system better for the American people and who's not. I guarantee you this, as long as we have President Trump and the White House and a majority of the Republicans in this chamber, we will never have political leadership that's fighting for universal health care, that's fighting for a public option that can be available to every single family in America. By the way, that's my proposal. It relies on everybody in America to make the best choice for their family. It's not something that would be imposed from here. It'd be the chance for every family to say, you know what, I'll stay with the private insurance I have, or actually I'd rather be on a system that's run by Medicare, where I know I'm going to have access to mental health care and health care for my family in a predictable way. And I'll just close. I can see my colleague from Massachusetts. I'll close by saying my heart especially aches for young people across this country, the people the age of my own daughters. I had a young woman ask me the other day, a recent graduate of Western State in Gunnison, Colorado. She said, "I'm coming off my parents' insurance when after I'm 26. You'll remember we put that in the health care bill. Before that, there was no opportunity for people to stay on their parents' insurance. We did it. We said you get to stay until you're 26. But then she said to me, "Senator, what am I supposed to do? Take 2 or 3 jobs to pay for my health insurance when I have to come off my parents' insurance?" And I said, that is exactly the right question. That is a question that 26 and 27 and 28-year-olds are not having to ask in any other industrialized country in the world. Only in the United States of America are we running a system where young people in their 20s have to decide between health insurance and their rent, or health insurance and food, or health insurance and the ability to put some money away to save for a house. And we should change that. I believe strongly that if we ever get to the point where we're expanding Medicare in this country, we should do it for the younger kids that are in their 20s first, because they've done absolutely nothing to design the system that they're inheriting. Mr. President, with that, I yield the floor.